Spinal stenosis is compression of the nerves or spinal cord in the neck or the cervical spine, or the back or the lumbar spine. And when the nerves are compressed, a patient could have symptoms in the arm or leg, such as numbness, tingling, pain, weakness, or clumsiness. Also, some patients present just with difficulty walking or clumsiness when they walk, or leg heaviness and tiredness when they walk. And this can all be due to spinal stenosis. Spinal stenosis can have a significant effect on a patient's lifestyle. Some patients will just have pain, which is annoying, or weakness in their arm or leg, whereas other patients can lose function, such as the ability to pick things up with their arms, or the ability to walk even half a block or 100 feet when they have lumbar spinal stenosis. We evaluate patients for spinal stenosis with the routine history and physical examination specialized for the spine, and then our stethoscope for spine surgery and spine problems is really the MRI, magnetic resonance imaging. We like to evaluate patients with an MRI of their cervical spine if they have complaints of neck or arm problems, or an MRI of the lumbar spine if they have complaints of back or leg problems. So we really like MRIs to evaluate the nerve compression, and we like X-rays to evaluate the alignment of the spine. So usually MRI, X-ray, history, and physical examination. Fortunately, most of the treatment options for spinal stenosis are non-surgical, meaning we can treat the patients without any surgery. And the treatment options include activity modification, physical therapy, anti-inflammatory medications, and interventional pain management modalities. That last one you may not understand or be familiar with. And interventional pain management modalities are basically epidural injections, facet injections, or different types of injections of local anesthetic and steroids into and around the spine to help decrease the inflammation associated with spinal stenosis. For patients that fail maximal non-operative management, we can consider surgery for the spine. And the surgeries can be broken down into two categories: conventional spine surgical techniques or minimally invasive surgical techniques. And we decide based on the problems that the patients present with and what their radiographs look like and what the MRI looks like. Some patients are better off with a conventional technique of peeling the muscle off of the spine, getting the pressure off of the nerves, and possibly restabilizing the spine if it's unstable. Whereas other patients may benefit from a minimally invasive technique where the incisions are smaller, there's less damage to tissue that doesn't need to be damaged, and we can focus the surgery on the area of interest and get the pressure off of the nerves and get the patients back to their full activity. As with other areas in medicine, spine surgery has evolved quite a bit over the last 10 years. And we now have tools that allow us to offer minimally invasive spine procedures to our patients that we may not have had 10 years ago. And these tools include the operating microscope, which basically provides us superior illumination and magnification of the tissues, which allows us to focus the surgery on the area of interest and perhaps minimize the size of the incision. The other tools that we have include advanced image guidance systems, which allow us to have better imaging in the operating room, which lets us guide the surgery again to the area of interest and provide our patients with excellent results. There's 3 phases to the care of a patient who has spine surgery, and each one of them is equally important. One is the preoperative phase, to make sure we perform the correct surgery for the correct patient and perform surgery only when it's really needed. The second phase is the one everyone tends to focus on, the one in the operating room, where we make sure that the surgery is performed technically, correctly, and efficiently. And the third phase is equally important, that of the post-operative recovery for the patient. That includes recovery in the hospital, where patients are taken care of by our team, including physical therapy, occupational therapy, physical medicine and rehabilitation specialists, and any other medical specialist that might be needed. Then, when the patients go home, they are taken care of by their family physician for any medical issues, and us for any surgical issues. And we'll also have the patients participate in outpatient physical therapy to make sure they regain as much function as they possibly can.